The Senate will come to order. Members, please rise for the prayer. Today's chaplain is our very own Senator Andrew Matthews from Senate District 15. And following the prayer, please remain standing for the Pledge of Allegiance.
Come and meet again for the business of government. Lord, I pray that you would continue to pour out your blessings upon Minnesota. Please bless our doctors and nurses caring for patients. Please bless workers and truckers and people working in grocery stores getting needed supplies to families. And Lord, we pray for healing for those that are sick right now. And may you, through your divine healing, help them recover and be restored fully. And thank you for what you are doing in the midst of this crisis. Lord, give us wisdom as we make our decisions today, and may you be honored and glorified. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
The Secretary will take the roll.
Senators Abler, Anderson B., Anderson P., Bach, Benson, Bigham, Carlson, Chamberlain, Champion, Clausen, Cohen, Swazinski, Dames, Dibble, Draheim, Dietzick, Eaton, Eichhorn, Eakin, Franzen, Friends, Gazelka, Goggin, Hall, Herr, Hayden, Hoffman, Housley, Howe, Ingebrigtsen, Isaacson, Jasinski, Jensen, Johnson, Kent, Kiffmeyer, Klein, Coran, Lane, Lang, Latz, Limmer, Little, Marty, Matthews, Miller, Nelson, Newman, Newton, Osmick, Pappas, Pratt, Rarick, Ralph, Rest, Rosen, Rude, Senjum, Simonson, Sparks, Thomasoni, Torres Ray, Utke, Weber, Westrom, Uyghur, Wickland.
A quorum is present. Good afternoon, members. As you are all aware, today we'll begin following the CDC and MDH guidelines for social distancing. Because of this is new territory, I ask everyone to please be patient and bear with us as we move through the procedures. An explanation of how we're going to proceed has also been sent to all the members before we met today. Before we go through those procedures, I want to point out a couple general rules. All alternate locations have a point person designated by the caucus who is responsible for contacting the front desk or receiving calls. For any electronic votes, senators will vote at their original desk in the chamber. If anyone has any questions at any time, they may talk to their point person in their room who will contact the front desk, and then we will pause proceedings until there's clarification. Whenever there is a voice vote, we will pause to allow the desk to call the alternate locations for their vote totals. When it comes time for an electronic vote, the members in the chamber will vote at their own desks. Then they will leave the chamber through the front door and wait until all other senators have voted. Then I will call each alternate location one at a time, and the members will come to the chamber, cast their vote at their own desk, and we will return to their alternate location. Once all voting is complete, I will announce the results and we will continue to the next order of business. If at any time a senator needs to address the body in debate or has a question, they should alert their point person, who will contact the front desk, and we will pause proceedings until that member arrives in the chamber or the question is clarified. If there are any objections, the senator should alert their point person, who will either contact their chief of staff or the front desk. We will pause and allow senators with objections to arrive in the chamber. That senator then may state their objection, as is in the traditional protocol of the Senate, and then we will proceed. With that said, let's proceed to the agenda. The first order of business is the 8th order of business, introduction and first reading of Senate bills. Listed in today's introduction calendar are Senate file numbers 4452 through 4458. These Senate files will be given their first reading and referred as indicated. Continuing to the 9th order of business, Senator Gazelka.
Mr. President, I move that Senate file number 4458 be laid on the table.
Discussion, Senator Gazelka. On that motion, all those in favor say aye.
Aye.
Opposed, say no. We will pause to call the alternate locations. Receiving a sufficient number of votes, the motion prevails. Moving to the 9th order of business, motions and resolutions. We have some authors' motions listed in the agenda. We'll take these authors' motions as one motion. All those in favor say aye. Aye. Opposed say no. Again, we'll take a brief pause to capture the votes of the members in the alternate locations. Receiving a sufficient number of votes, the motion prevails. Senate Resolution number 228 will be referred to the Committee on Rules and Administration. The Secretary will read Senate Resolution number 229.
Senators Gazelka and Kent introduce Senate Resolution number 229, a Senate resolution amending the temporary rules of the Senate.
To the resolution, Senator Gazelka.
Mr. President, I move that Senate Resolution number 229 be adopted.
To that motion, Senator Gazelka.
Mr. President, members, we are about to begin to hold committee hearings again, and we're going to do that through digital technology so that people can join that from different sites, and so we needed a resolution to bring that about. The resolution amends the temporary Senate Rule 12 to permit remote Senate committee meetings for the duration of the peacetime emergency related to COVID-19.
Any further discussion on the resolution? Seeing none, Senator Gazelka renews his motion to adopt Senate Resolution number 229. All those in favor say aye. Aye. Opposed say no. Again, we'll take a brief pause. Receiving a sufficient number of votes, the motion prevails. Remaining under motions and resolutions, will revert to the third order of business, messages from the House. The Secretary will read the message.
Mr. President, I have the honor to announce the passage by the House of the following House file herewith transmitted. House File Number 4537, a bill for an act relating to workers' compensation, providing a presumption for COVID-19 workers' compensation claims for certain employees. Patrick D. Murphy, Chief Clerk, House of Representatives.
There's no action required on that message. The next order of business is the fourth order of business, first reading of House bills. The Secretary will read the House file number.
House File Number 4537.
House file number 4537 is given its first reading. Senator Gazelka.
Thank you, Mr. President. I move that an urgency be declared within the meaning of Article 4, Section 19 of the Constitution of Minnesota with respect to House File 4537, and that the rules of the Senate be so far suspended as to give House File number 4537 its second and third reading and place it on final passage.
To that motion, Senator Gazelka.
Members, this is the workers' compensation bill that we're about to discuss.
Any discussion? Seeing none, Senator Gazelka renews his motion to suspend the rules on House File 4537. Is there any discussion? Seeing none, all those in favor say aye. Aye. Opposed say no. Motion prevails. The Secretary will read House File 4537 so we can give it its second reading.
House File Number 4537.
Second reading. Senator Howe, discussion on House File 4537.
Thank you, members. Mr. President, thank you, Mr. President and members. House File 4537 is the first responders workers' compensation bill. House File 4537 ensures that certain frontline workers who contract COVID-19 while performing their job duties are eligible for workers' compensation benefits without having to prove that they were infected on the job. An individual who is employed in a covered job classification is presumed to have an occupational disease if they contract COVID-19, thereby making them eligible for workers' compensation benefits. This presumption is contingent on the contraction of COVID-19 being confirmed by a positive lab test, or if a lab test is not available, but as diagnosed and documented by employee's licensed physician, licensed physician assistant, or a licensed advanced practice registered nurse based on symptoms. A copy of the positive lab test or written documentation of the diagnosis shall be provided to the employer or the insurer. The date of the injury for the employee who has contracted COVID-19 is the earlier of the date that the employee is unable to work due to COVID-19 diagnosis or symptoms that were later diagnosed as COVID-19. The following workers are covered under this bill: licensed peace officers, firefighters, paramedics, nurses, healthcare workers, correction officers, and security counselors employed by the state or political subdivision at a corrections, detention, or secure treatment facility. Emergency medical technicians, healthcare providers, nurses, assistive employees employed at a healthcare, home care, or long-term care setting with direct COVID-19 patient care or auxiliary work in COVID-19 patient units, and workers who are required to provide child care to first responder and healthcare workers under Executive Orders 20-02 and 20-19. This change applies to employees who contract COVID-19 on or after the day following enactment and has a sunset date of May 1, 2021. An employer or insurer may only rebut this presumption by showing that the employment was not a direct cause of the disease. A notice of denial of liability must state the facts forming the basis for the denial in detail and include specific reasons why the claimed injury or occupational disease was determined not to be within the scope and the course of employment. The Commissioner of Labor must provide a detailed report on COVID-19 workers' compensation claims to the Workers' Compensation Advisory Council and to the chairs and ranking members of the House and Senate committees that have jurisdictions over workers' compensation by January 15, 2021. This bill also gives the Commissioner of the Department of Labor and Industry the authority to extend the implementation date of the workers' compensation campus system. I tell you what, folks, these are the people that take care of us, and we need to take care of them. I will tell you that it means a lot to me to be the chief author of this bill. Every one of my siblings were either firefighters or first responders. The firefighters, I will tell you, the firefighters were the first to sound the alarm on this issue. They're the ones that brought it to me, and I will say that those that did the heavy lifting on this bill, along with Senator Miller, were the Minnesota Professional Firefighters, the Minnesota Nurses Association, the Minnesota Teamsters Joint Council 32, MPPOA, ASME, and the SEIU Healthcare. Again, I'm honored to carry this bill, and I strongly urge a yes vote on the bill. Thank you.
Further discussion on House File 4537, Senator Miller.
Thank you, Mr. President and members. I'd like to thank Senator Howe and Senator Simonson for bringing this bill forward today and the other co-authors on the bill. I'd like to thank Democrats and Republicans in the House. I'd like to thank Governor Walz and his administration. And I'd also like to thank all the stakeholders for coming together and helping make this happen. Members, we were in this chamber less than 2 weeks ago debating a very important emergency relief bill related to COVID-19 in the tune of over $300 million of relief. And you might remember when we were in this chamber less than 2 weeks ago, Senator Simonson gave a very passionate speech about this workers' compensation issue for our first responders, healthcare workers, and others. And as I presided over the Senate that day, not only did I hear the passion in Senator Simonson's voice, but I saw it in his eyes. And there were two thoughts that came to my mind. The first one was, we had to get this done. And the second one was that this was so important, like all other workers' compensation insurance issues, that it had to go through the Workers' Compensation Advisory Council. And I know the members in this chamber know about the council, but the folks that are listening or watching back home might not be as familiar with the Workers' Comp Advisory Council. And this council includes an equal number of members represented by labor groups and business groups. And because workers' comp changes or proposed changes to the current workers' comp law are highly controversial and very complex, there's a long-standing precedence that any workers' comp issue that we vote on in the House or Senate must first get approved by that council. So that's why it was extremely important that it go through the Workers' Comp Advisory Council and get their stamp of approval. So as we were here less than 2 weeks ago, Senator Gazelka made the commitment that we were going to work together with the stakeholders to get this done. That was on a Thursday. Friday rolled around, Saturday, Sunday, Monday, I made a call to Senator Pratt, and he had indicated that the discussions towards an agreement had broken down and that there was an impasse. So Senator Pratt, Senator Gazelka, and I got on the phone, and I said, we have to get this resolved. We have to get this done for the workers who are on the front lines of this crisis. So 1 week ago today, last week Tuesday at 7 a.m., 7:05 to be exact, I started making phone calls to the stakeholders, the labor unions who were involved in this, the business groups that were involved in this, and I explained the importance of why this needed to get done. They knew it needed to get done. And I asked, what is the common goal? What are we trying to accomplish? And then what is the path to get to that goal? And by Thursday afternoon, we had the framework of an agreement in place. Now, when Senator Gazelka mentioned that we worked around the clock to get this done, anyone who doesn't believe him, please check with my wife, because the first call every morning at about 7 a.m. was to someone trying to get this done. Throughout the day, we worked on it. The last call at about 10:30 p.m., maybe even later, was regarding this issue. I was up half the night, if not more, because I was laser focused on trying to figure out a path to an agreement on this issue, because that's how important it was. And while we had the framework of that agreement on Thursday, there were a few more obstacles that were thrown at us. And as a result of hard work and efforts throughout the weekend, by Sunday evening, we had an agreement in place, and we were prepared to have this go in front of the Workers' Comp Advisory Council on Monday. Had unanimous support in that council, and here we are a week later voting on it in this chamber. So members, today we have an opportunity to make this happen and get this done for our firefighters, our nurses, our healthcare providers, our police officers, our paramedics, our correctional officers, our personal care attendants, and others who are on the front lines of this COVID-19 crisis. And after we get this done today, and we pass it through the Senate and send it to the governor for his signature, these workers on the front lines will have one less thing to worry about when they're at work taking care of Minnesotans. So today, I urge a green vote. Let's get this passed. Let's send it to the governor, and let's show these workers that we appreciate all their efforts and that we have their backs.
Further discussion on House File 4537, Senator Simonson.
Thank you, Mr. President, and thank you, members. Thank you, Senator Miller, Senator Gazelka, Senator Pratt, Senator Howe. I know you've worked very hard over the last several days in order to get this done. And I think Minnesota's frontline workers appreciate that and appreciate the work that you have done. I know I do, and I offer my thanks. I also want to recognize all of the countless hours that staff has put into this effort, both partisan, nonpartisan staff, as well as members of the executive branch. We are facing unprecedented times, as we know, and it takes really a great effort on everybody's part in order to pull something like this together, and we appreciate that work. I also want to thank Senator Champion. Senator Champion is our DFL lead on the Jobs and Economic Development Committee, and he and the other members of the committee have been 100% supportive of all of us as we have tried to work through this and to get this done. So I think that this is one of those bills where we can stand up and we can say there's no partisan lines here. This is about Minnesota Senate coming together and doing what's best for Minnesota's first responders, those on the front line. Because we know that they appreciate it, we know that they need it, and we're happy to come together for them. I think all of the members of the Minority Caucus would love the opportunity to stand up and say thank you and express their appreciation to everybody for getting this done on behalf of those Minnesota workers. We're just in a situation where we can't really accomplish that today. But I know they've all reached out to me and expressed their thanks and gratitude, so I'll pass that along to all of you. The final piece that I will just add is that this is but one step in the process. And I think all parties have committed to figuring out a way to find a funding mechanism for this effort. If there's one thing that we don't want to do is to pass unnecessary burdens and costs onto our local employers, be they private business or some of our local units of government. And I know as late as very, very late last night that efforts continue to find a mechanism to accomplish that. So I look forward to seeing that get across the finish line. But most importantly, today is about getting this policy across the finish line. So as Senator Miller expressed very eloquently, those first responders have just one less thing to worry about. So with that, I also encourage a green vote. Thank you, Mr. President.
Further discussion on the bill? Members, if there are any amendments or any discussion before third reading, please notify your lead or the front desk. Otherwise, we'll move to third reading and then start with a list of members who wish to start after third reading. Hearing no activity at the desk, the Secretary will give the bill its third reading.
House File Number 4537.
Third reading. First on my list will be Senator Abler, followed by Senator Nelson. Senator Abler.
Thank you, Mr. President and members. This is really unusual, running from upstairs to come talk down here, and I'm really happy that we took the time to come back today to solve this very important matter. It is a big deal. We have people standing in harm's way, and some people aren't included by this, but these individuals are committing their lives and their fortunes to looking after us, and it really is good that we can come back and pretty much do this as our main order of business, and I'm really proud to be a part of that. I did want to mention one thing, though. There was a letter sent. I think 58 people wrote the governor saying this is a big deal, we need to deal with it today, and I want to remark why I didn't sign that letter. I supported forever, as did the people who didn't sign that letter, the individuals covered by today. But it has to be done well, and I was fearful that given the version that was, it actually would have bankrupted hospitals and many other businesses that would have actually defeated the entire purpose of what the bill was. And I want to commend all the people that worked on this, Senator Miller and Simonson and Howe and the rest of the different groups that got this put together in a way that actually makes a good deal of sense. And so what we were risking seemed like a good idea, but it would have caused some harm. And I want to take a moment to mention in a gentle way, and I know the governor's tied up with his press work right now, but I hope he listens to this conversation, because he's trying really hard, and there's not a more sincere person in this state trying to make us safe from COVID and with the distancing, and I think it's actually catching on. Minnesota's been successful to have the lowest rate of infections, and good for us. But there's a part in this that's gone from the beginning that I've been corresponding with him for over 2 weeks, maybe longer. It seems like a year we've been here. Maybe it's 3 weeks now. That some of these rules that are set up about people who cannot work aren't doing any good. And I could read a long list about those kinds of groups, and I did actually last week when we were talking about this. But rather than read a list, I suggest that we move from essential businesses to business practices. There are so many businesses that have gone out of their way that are open now to be careful. But frankly, some of those businesses that are open have done a really poor job, and they're allowed to be open. There are thousands and thousands and thousands of businesses and families who are ready to go back to work and do the things that we take for granted every day. And I'm fighting the temptation to read you a long list, but there's thousands, and they are being barred from their ability to earn a living, and feed their families. And Governor, I know you ran on one Minnesota. We're really a half Minnesota. Anoka is half a town. There's nobody down there. These small companies that have been open as legacy businesses are languishing, and some will never open. And it's avoidable and can be changed today. I know, Governor, you're going to be deciding this pretty soon about having us stay in our homes or not, and you're going to do whatever you do about that. And I think that has made a difference in a positive way. But I can tell you, the businesses who didn't open when they would have operated safely have done nothing to fight COVID, except to cause unnecessary harm. And so Governor, in my kindest way, I beg you to consider this. Frankly, I had many more graphic examples I was going to bring up, and I thought it would be better to stick with the honey and to tell you that the people in my district that are talking to me are really worried about paying their property taxes. They barely made their rent just a couple days ago, and they don't know how they're going to make it work. And frankly, Governor, you know that we and the federal government don't have enough money to pay all the things we wish we could pay for these individuals. There's a big challenge coming. If you can act now and allow these companies who are safe, that have good practices to open, the need to pay for all those things will be much less. The big deficit will be much shorter. So thank you, Governor, and to members. I appreciate you listening to this.
Further discussion? There's no one on the list after Senator Nelson who wants to speak before the end list, so notify the front desk if you wish to speak. Senator Nelson.
Thank you, Mr. President. I stand here today in support of the bill before us. It is good to see business, labor, House, Senate, Republicans, Democrats coming together to make sure that those men and women who are on the front lines fighting this crisis, this pandemic, are going to be taken care of. We need to make sure that they have access to the support and resources should they come down with COVID-19. They are putting their health and well-being at risk to protect, to serve, and to provide necessary life-saving health care to Minnesotans who have come down with COVID-19. And these workers, the nurses, the paramedics, the sheriffs, the police, our first responders, our healthcare providers are working diligently, putting themselves at risk. They do that all the time, but this is a greater risk. And it's important that we as a state came together and made sure that they would be covered under workers' comp should they themselves be infected with this disease. This is the type of one Minnesota that we should have. where we are all working together. So I applaud the labor, the business, the House, the Senate, the Republicans, Democrats, who have all come together to make sure that we get this out the door today. It is essential, and I encourage a green vote.
Any further discussion to House File 4537? Senator Pratt.
Well, thank you, Mr. President. I want to thank Senators Howe, Senator Miller, and Senator Simonson for the work on this bill. We would not be here today standing up for our frontline folks if not for the commitment of these three senators. As this is an unprecedented health emergency, continues to unfold, this bill will make sure our brave workers on the front line have access to full occupational protections. These workers are doctors, nurses, EMT, firefighters, and law enforcement officers in our community need to know that they and their families will be taken care of if an incident arises. For weeks, we've been working with representatives from organized labor and the business community to find an agreeable path forward on this issue. In addition to the two senators, I want to thank the representatives from SEIU, AFSCME, the nurses, police, and firefighters who put their differences aside to work and approve this deal. I also want to thank the Chamber of Commerce and the insurance industry for their efforts as well. And it was mentioned earlier, and I also want to thank our Senate staff who put in extremely long hours, specifically Ms. Doyle Fontaine, who worked extremely long hours and through the weekend to help us get this done. I believe this legislation reflects our state's commitment to protect those workers who are protecting us. And Mr. President, I am proud to support this bill today.
Final discussion on House File 4537, Senator Miller.
Thank you, Mr. President. I will just echo much of what Senator Pratt just said. I applaud the labor unions and the business groups for focusing on the areas of agreement rather than on the areas of disagreement and helping us get this across the finish line. And the staff behind the scenes also worked day and night to help get this done. Carlin Doyle Fontaine from our Senate Council was a rock star, and she did incredible work. The revisor's office, everyone in the revisor's office who worked on this, rock stars, they did great work. So to everyone who was involved, thank you for helping us make it happen.
Final discussion on the bill, Senator Kent.
Thank you, Mr. President. I also want to rise and take a moment to recognize our first responders who are out there right now and working around the clock to keep Minnesotans safe, while many of us are at home with our families and loved ones. All across the state, our firefighters, paramedics, corrections officers, healthcare providers, and nurses wake up every morning in the middle of this public health emergency to head into yet another day of work to keep us safe. They deserve to know how much we all value them. We all talk about how important it is to stay at home for those who can. Those who can't stay home are the first responders that we're here for today. And while staying home is one way that each and every Minnesotan can show our appreciation for them, today's passage of legislation that ensures that they have the workers' compensation protections that they need and deserve is another way that we are showing our gratitude for their hard work and sacrifice. Senator Simonson, who was a critical advocate in ensuring this legislation was passed, mentioned on the floor the last time we were here, quote, "We need to take care of those who are willing to take care of us." And he was so right. So I want to take a moment to thank them, and not just because those first responders are helping our neighbors and communities every single day, but because they continue to do so despite the concerns, fear, and uncertainty that they and their families are facing. They have friends and families and loved ones they're thinking about every day when they wake up and head to work. I also want to thank the leaders of the legislature and the caucus leads and the staff for coming together to act so swiftly and ensure the support can be delivered. And particularly when it comes to the staff, I think it's worth pointing out that everybody is working under pretty unusual circumstances, and it just makes it that much more difficult to turn around the kind of work that we need to turn around. But in this case, it is absolutely worth it. So members, as we continue our work to respond to the needs of Minnesotans during this pandemic, we must remain united as state leaders. As the governor mentioned this past weekend during his State of the State address, unity, humanity, and gratitude is what will get us through these unprecedented times. And that is what we are here showing today. Thank you, and I also encourage everyone's support for this bill.
Senator Gazelka.
Thank you, Mr. President. Members, this is obviously a green vote. I hope it's unanimous. I promised that we would make sure that we looked out for the nurses, the firefighters, the police officers, the first responders, that we'd have their back, and this has been a bipartisan effort. I particularly thank Jeremy Miller for not giving up when it didn't seem like it was going to happen. But this is just one of a couple of steps. The other thing that we promised, we'll turn over every rock to make sure that we find the gloves and the masks and the things that they need for protection. If we have to, we'll move heaven and earth to get it done, and that, again, will be bipartisan. So, members, this is a green vote.
And final comments on House File 4537, the author of the bill, Senator Howe.
Thank you, Mr. President. And I can't tell you enough how thankful I am for everybody's support on this, because we worked tirelessly to try to get this across the line. And when the deal fell apart, it was heartbreaking. But when we walked out of here a couple of weeks ago and Senator Gazelka said, we're going to get this done, I knew that the support and the effort was going to be there. And I sincerely think that Senator Miller stepped in and was able to keep the discussions flowing, that this thing finally became reality. And we're here today to take care of the folks that need to be taken care of. So thank you, members, and I urge a green vote.
Members will proceed to a vote, and we'll call each alternate location individually. So please wait until your room is called. The secretary will take the roll on House File 4537. Members in the chamber, please vote at your own desk. Members in the retiring room, please come and cast your votes. Members in the East Gallery, please come and cast your vote at your desk and then return to your location. Members in the President's office, please come and cast your votes and then return to your alternate location. Members in room 206, please come and cast your votes. Members in room 303, please come and cast your votes. Members in room 237, please come and cast your votes. Members in room 323, please come and cast your votes. We'll now call on the leaders for members casting votes from remote locations. Senator Kent.
Thank you, Mr. President. I would like to report an aye for Senator Jim Carlson.
Senator Carlson votes aye. Senator Kent.
I would like to report an aye for Senator Greg Clausen.
Senator Clausen votes aye. Senator Kent.
I would like to report an aye for Senator Kerry Dietzick.
Senator Dietzick votes aye. Senator Kent.
I would like to report an aye for Senator Chris Eaton.
Senator Eaton votes aye. Senator Kent.
I would like to report an aye for Senator Melissa Franzen.
Senator Franzen votes aye. Senator Kent.
I would like to report an aye for Senator Jason Isaacson.
Senator Isaacson votes aye. Senator Kent.
I would like to report an aye for Senator Matt Klein.
Senator Klein votes aye. Senator Kent.
I would like to report an aye for Senator Carolyn Lane.
Senator Lane votes aye. Senator Kent.
I would like to report an aye for Senator Ron Latz.
Senator Latz votes aye. Senator Kent.
I would like to report an aye for Senator Jerry Newton.
Senator Newton votes aye. Senator Kent.
I would like to report an aye for Senator Sandy Pappas.
Senator Pappas votes aye. Senator Kent.
I would like to report an aye for Senator Ann Rest.
Senator Rest votes aye. Senator Kent.
I would like to report an aye for Senator Dan Sparks.
Senator Sparks votes aye. Senator Kent.
I would like to report an aye for Senator Patricia Torres Ray.
Senator Torres Ray votes aye. Senator Kent.
I would like to report an aye for Senator Melissa Wickland.
Senator Wickland votes aye. Senator Gazelka.
Thank you, Mr. President. I would like to report an aye for Senator Bruce Anderson.
Senator Bruce Anderson votes aye. Senator Gazelka.
Thank you, Mr. President. I'd like to vote aye for Senator Gary Dames.
Senator Dames votes aye. Senator Gazelka.
Senator Dan Hall votes aye.
Senator Hall votes aye. Senator Gazelka.
Senator Karen Housley votes aye.
Senator Housley votes aye. Senator Gazelka.
Senator Scott Newman votes aye.
Senator Newman votes aye. Senator Gazelka.
Senator Jerry Ralph votes aye.
Senator Ralph votes aye. Senator Gazelka.
Senator Julie Rosen votes aye.
Senator Rosen votes aye. Senator Gazelka.
Senator Kerry Rude votes aye.
Senator Rude votes aye. Senator Gazelka.
Senator Bill Weber votes aye.
Senator Weber votes aye. Senator Gazelka.
Senator David Senjum votes aye.
Senator Senjum votes aye. Senator Gazelka.
Senator Tory Westrom votes aye.
Senator Westrom votes aye. The Secretary will close the roll. There being 67 ayes and 0 nays, the bill is passed and its title agreed to.
Remaining under motions and resolutions, we'll take up the third order of business, messages from the House. The Secretary will read the message.
Mr. President, I have the honor to announce the adoption by the House of the following House concurrent resolution herewith transmitted. House Concurrent Resolution Number 5, a House Concurrent Resolution relating to the adjournment of the House of Representatives and the Senate until the public interest warrants it. Patrick D. Murphy, Chief Clerk, House of Representatives.
Senator Gazelka.
Thank you, Mr. President. I move that House Concurrent Resolution Number 5 be adopted.
Discussion, Senator Gazelka.
Mr. President, members, this moves the next adjournment date to April 14th, 2020, unless the Speaker and myself bring us back earlier.
Any discussion on House Concurrent Resolution Number 5? Seeing none, all those in favor say aye. Aye. Opposed say no. Receiving a sufficient number of votes, the motion prevails. Continuing to the 13th order of business, announcements of Senate interest. Members, are there any announcements? Senator Matthews.
Thank you, Mr. President. I would just like to urge our governor, our leaders right now as we're considering whether to give an extension of the shelter-in-place order right now. I wanted to share a letter that I got from a constituent who runs a marine and boat shop in my district on Lake Mille Lacs. And he told me right now he has 400 boats that are in storage sheds that he stores for his customers over winter. And the fishing opener right now is still scheduled to go as originally planned. There's been no indication that the fishing opener will be delayed. But the work right now leading up to fishing season has been some of the things on the non-essentials list. And this is what my constituent has found. He's right now not allowed to be able to pull the boats out of the shed and get them prepared for his customers for the fishing season. And going off of what Senator Abler urged earlier in his speech, I think there are opportunities for us where businesses can be safely opened up in these next few weeks that are currently not allowed to operate right now, that would still maintain this level of safety, of distancing, of the other paradigms we've put in place during the times of this pandemic. And so I want to urge the governor, I want to urge the leaders that are considering the extension of this order, that just a blanket extension for a few more weeks would be harmful in a lot of areas, impacting a lot of our businesses that can safely operate today. So I spoke with this owner who laid out that he and the few employees he has can easily do the work that they need in completely opposite ends of this large warehouse, this large storage facility that he has. And they will plan to, if they are allowed to, be able to get their boats prepared, bring them to the front of a parking lot, call the customer and tell them to come pick up the boat at the front of the parking lot, be able to leave a payment in a slot on the door or through some alternate means that they'll arrange. And there are ways for businesses like him with his marine repair shop to be able to safely operate with no customer interaction that would continue to maintain the safety and the distancing that we need. So I want to urge the governor, for businesses like him and many others, let these business owners come up with their ideas of how they know they can already operate safely, and let's trust them to follow through on it. We can review it, we can make sure that it meets a certain standard, but there are businesses that need to be open and operate soon to help the people in our district. And I think this would help alleviate the unemployment claims that we have backing up right now, the other areas that this is impacted. This is a necessary help, and I just urge the governor to take this into consideration as he decides what to do with his order. Thank you, Mr. President.
Any other announcements? Seeing none, Senator Gazelka.
Thank you, members. I'm about to adjourn, but I just want to say our intent is to come back April 14th and return to the new normal, where we'll be meeting every 3 days, and yet we're going to follow the distancing guidelines and use technology to do conference or committee hearings via Zoom and other avenues. And so this will be new for us. We'll have to navigate through it, but that will be how we return on April 14th. And then finally, I know this is an important time for Christians and the Jewish community, and as I personally celebrate Easter, I just want to let people know how important it is that we look to heaven in times of crisis like this, and I do believe that our loving God answers our prayers. So with that, members, Mr. President, I move that the Senate do now adjourn until Tuesday, April 14th, 2020, or until a date and time determined pursuant to House Concurrent Resolution Number 5.
On the Gazelka motion to adjourn, all those in favor say aye. Opposed say no. Motion prevails. The Senate is adjourned.